Cynthia, Toronto Public Health says it's stepping in to do what the province isn't, and that's collecting race-based data during COVID-19. And it's not the only city here in the GTA that's doing so in what Black health leaders are calling a necessary measure to achieve health equity.
It is an important element of better understanding the impact of COVID on our city and the residents.
Welcoming news for Black community health leads who for years have been calling on governments across Canada to collect race and ethnicity-based data across communities, especially now during one of the worst public health pandemics the world has seen. And as troubling trends in the U.S. emerge, higher rates of infection and deaths among African Americans and Latinx communities.
We know that the burden of health falls very inequitably on those that are marginalized, on low-income communities, on those that are racialized.
There is a network of hospitals and clinics such as the Regent Park Community Health Center who for years now have been collecting race-based data. That information has already shown how certain communities are at higher risk of illnesses, who is accessing health care and who can't, who is being screened for cancers and who isn't. Toronto Public Health says it's going to lean on the existing network in an attempt to collect this data during the pandemic.
We are partnering proactively with some hospitals, some research institutes, and the public health school at the University of Toronto.
Studies have shown that there is a strong link between low income and health disparities, factors that include food insecurity and affordable housing. In 2016, Ontario's Chief Medical Officer of Health drafted a report that outlined how health inequities are impacting communities. To understand these risks, he called on the Ontario government to provide data. Fast forward to Monday, when provincial health leaders warn that those in low-income neighborhoods are at higher risk of COVID-19.
There's, more broadly speaking, a very strong correlation between race and poverty.
Despite these jarring statements, the province, who mandates data collection, has not committed to collecting that information.
Toronto Public Health is doing this work because the provincial government is not.
Without these types of data, we are not able to fully understand if this pandemic is disproportionately affecting certain people in our community and ways to address these potential inequities.
Joining Toronto, Peel Public Health began collecting race information for probable and confirmed cases to determine how to best respond to the community. While York Region and Hamilton say they are not, Durham has not responded to our media requests from this morning. To form a better response that is inclusive of marginalized and racialized communities, experts say more accurate and reliable information is needed. The larger the data for the health system, the better. Therefore, maintaining calls on provincial and federal leaders to prioritize ways in understanding the barriers communities face in accessing health care.
Ultimately has to be aggregated, it is anonymized, and it is much larger patterns that we're trying to understand in order to develop effective public health strategies.
And Toronto Public Health also announced the launch of a new information system to manage case and contact tracing. We have reached out to the province, more specifically the Ministry of Health and Long-Term Care, to get a response early this morning. We are still waiting to hear back. We continue to follow the story on City News and citynews.ca.